So opioids are often very appropriate for acute pain. They are our first line for severe nociceptive pain, so post-operative pain, injury, things like that. They're effective, we know they work, they're a very known quantity. They're safe, they're a known entity in terms of their safety, and they're relatively inexpensive. However, what we see is a lot of patients started on these for acute events and they aren't reviewed properly and they remain on them for the long term. And we know in terms of efficacy for chronic pain, they just don't work. They just don't have the data of being effective for treating chronic pain. So when we look at this, we want to consider the idea of cancer versus non-cancer pain. Cancer with opioids, we kind of put that into a different category and we don't apply the same scrutiny to that. That it's in a separate class of its own. But for chronic non-cancer pain, there's a lot of data in this area and it's certainly coming into focus. More recently what we're seeing, and this is quite recent updates, that opioid deaths have eclipsed those of what we see in road traffic deaths in countries including Australia and America. So again, this is why it's becoming more of an area of focus. And just with that idea that often the use that it's being used for chronic pain is not appropriate because it just isn't an effective choice.